Is there any type of, do you feel like there's one area in which women need more education pre and postnatally when it comes to pelvic floor health? Like, what are the tips, or, what would be the biggest education points for women?
I would love if all women could go to a pelvic health physical therapist, get evaluated, and get all the tips because there's so much to share. There really is. And I'm always hearing feedback from my clients. Whoa, I'm so glad I came to you, or whoa, I wish I'd known this for my first pregnancy. But let me think if there's anything I can say. I think two things prenatal to think about are getting educated in labor and delivery positions, because that can make a huge difference, huge difference in the outcome and the comfort during labor and delivery. And and then the perineal massage, that's a big one too.
And when you're saying labor and delivery positions, do you mean like whether it's sitting versus on your back, delivering on your back? Is that what you mean?
Yeah, labor is very slowed down if a woman is on her back. That's the worst position. And it can really change just the position of the pelvis, can change how much room the baby has to exit. And that changes during the course of labor. At the beginning of labor, more of a posterior pelvic tilt is helpful to open up the pelvic inlet. And then an anterior pelvic tilt is better later during delivery to help open up the pelvic outlet. So just knowing things like that is very helpful for women during their labor, and being upright, allowing gravity to do its work, knowing to alternate between more active or upright positions and resting positions as needed to conserve their energy. But yeah, by all means, trying to stay off their back the whole time and trying to postpone an epidural or not have one at all if possible. That's in their playbook.
Yes, I'm with you. I had a failed epidural my first birth, and so that was actually fortuitous because I essentially didn't have any anesthetic. So it went smoothly. It went probably more smoothly than if I'd had an epidural. And then I had midwives for my second pregnancy. And so they taught me a lot more, than in my first pregnancy. So including about labor and delivery positions. But I think that's so crucial for women. And I think that's great. I love what you just explained, and I think it'll make a great video.
Oh, good. I'm glad.
How about postnatally? What would be some of your biggest tips for women postnatally?
Right. And again, I would recommend seeing a pelvic health physical therapist if they have any questions or concerns. Pain that's lasting more than just a week or two at the most, I would say. And just, or feeling any back issues, pelvic alignment issues can come up during delivery, can be created during delivery actually, and need to be sometimes corrected. And not delaying trying to get help if at all possible with a pelvic floor physical therapist for that. But also, listening to their body, but not being afraid to move, and trying to just really kind of take it one day at a time, doing a little bit more each day as possible. But being very conscious of things like posture, that can make a big difference when women are trying to breastfeed, and that's the primary importance, is just trying to get the baby to latch on and quiet and supporting them well. And sometimes that's at the cost of the mother and her back. And just trying to get educated on the best ways to do things like that, or just getting support and help if they're having issues and pain with that, because there is help.
That's awesome. That's really great advice.